Have you ever wondered how perfect and multi-purpose our organs are? Take the instance of the kidney. This 10 centimeters long structure does so many functions that if it is damaged, it has to be replaced by a huge big machine which does the dialysis. What a magnificent gift from the Almighty. Let's take another example of this 3-in-1 organ called the penis. It's marvelous how the 3 compartments are totally separate from each other and yet the organ is the same. What are these 3 functions of the penis? Firstly, erectile function. Secondly, it releases the semen which contains the sperms through which fertility occurs. And thirdly is urination. The beauty is that all 3 compartments are separate, yet the organ is the same. So erectile function is performed by 2 tubes which lie on the dorsum or the upper part of the penis. The part that when you look down, you see the 2 tubes covered by the skin. If there's any malfunction in this area, there's erectile dysfunction. But the passage of urine is not disturbed and the semen count, motility and etc. is not disturbed at all. So only one part is affected. Similarly, on the undersurface of the penis is the urethra covered by a spongy tissue known as corpus spongiosum. Now, if there is some damage to this part, then there is a specific problem with the passage of urine or semen, but the erectile function is not affected. Beautiful. Even though all 3 functions are performed by the penis, each compartment is independent of the other. And in fact, if there's any disease or if there's any problem of one compartment, the other compartments carry on the function by and large. It therefore becomes very important to take care of this unique structure. We hardly ever give thoughts to the amount of function the penis is handling. If there is damage to the 2 tubes which carry the blood to the penis, inside the penis, then we get problems with the sexual activity. If there's damage to the tube that brings the urine out, then we get problems with passage of urine. While the semen is not affected in the manner of decreased function. Equally, if the seminal vesicles or the root of the semen is affected, then that's the only part that's affected. Urine still carries on freely passing out and the erectile function carries on as usual. It is only the semen that is affected. Therefore, there's one important thing in all this is that in case of erectile dysfunction, you do not need to do a semen analysis. In case of semen problems, infertility problems, you do not need to do a workup for the erectile function or the urinary function. Sometimes, very rarely, one function may affect the other function, but that's rather rare. With all these activities, isn't it important for us to take care of the penis, to take care of its good functioning, to take care that nothing goes wrong with it? There are a few steps that we can take to do that. Masturbation is a very important activity of the penis. And using unconventional methods of masturbation is a no-no if you have to protect your penis. What do I mean by unconventional methods? Using prone masturbation, lying down on the bed and rubbing the penis against the bed. This can damage the penis and may affect one of the 3 functions. Sometimes penis gets infected, in which case it may affect the semen as well as the urine problem. Coming back to the masturbation, there are other unconventional methods of masturbation like using a bottle to masturbate. And that again can damage the skin of the penis and indeed the muscles of the penis and the urethra, in which case we get problems with one or more functions of the penis. Then there are abuses of the penis, like using it in too excited manner during sexual intercourse. And it may hit against the pelvis of the partner, in which case there can be a fracture of the penis. So you have to prevent penile injury. You have to be careful and just not take everything for granted. It follows therefore that it's important not to try heroics during sexual intercourse. The way it's meant for being used, it should be used. Diet and exercises have a big role to play in keeping the penis at its functionally best level. How it does that is through preventing oxidative stress. This is a function of the cell at the micro level, and oxygen supply is important to maintain this part. Antioxidants are required, which are present in diet rich in green leafy vegetables. Antioxidants are also present in dry fruits and so on. One thing we can all do is not to use drugs that affect the penile function directly or indirectly, because damage to the penile muscles is a very difficult condition to treat later on. Using drugs like Viagra or sildenafil in disproportionate quantities just to have an extra kick may damage your penis permanently. And if unfortunately you do have infection of the penis, then once you treat it promptly and without any shame, you should go to the doctor and get it sorted out. There are some precautions that you can take, and one of them is cleaning up the penis very thoroughly during bathing. If your skin is an uncircumcised penis, then the skin covers the tip of the penis. Pull the skin back during bathing and clean that area which lies between the skin and the red part of the penis. This is known as the sulcus of the penis, and that is where infections accumulate. The smegma or the substance that is released from the glands of the penis accumulates. If smegma remains there for a long time, it can get get infected, and it is believed that this is maybe one of the causes of cancer of the penis. So do clean your penis thoroughly, pulling the skin back and cleaning the area between the skin and the penis structure. Sometimes people use various things for fun purposes. One of the weird things I've seen as a patient, is the use of a ring which they place on the base of the penis to increase the erection. And the poor man fell asleep after that, and when he got up, the ring was still there, but his penis was edematous and black and blue distal to the ring, or beyond the skin where the ring had been placed. That had become a constricting element. I had to get the local carpenter to get the ring removed. But such things are dangerous because you're spoiling the properties of the penis, and while maybe it may recover, chances are that you'll have some problems later on. I've already mentioned about the excessive use of drugs like Viagra. Testosterone injections are again another favorite one that are misused. Inject too much of testosterone, you can damage the skin muscle of the penis permanently. So gentlemen, keep it gentle so far as the penis is concerned. Do not try heroics with this organ, which is so important to mankind. Not because it does the sexual function, but also because it's a multi-purpose organ and a unique thing to men. In short, take care of the penis, prevent any infections, and if the infections occur, get them treated. Clean the penis thoroughly, including the area that I've mentioned between the skin of the penis and the glans penis, or the red area. Do not put anything down the urethra. Do not use constricting substances around the penis. Do not rub the penis against the bed or any other pillar. Use it for the purpose it's meant for, and you will never regret it. Otherwise, you may have problems with this unique organ. If you've liked the video of today, please press the like icon. If you have any comments or suggestions to make, or indeed would like to know more about something else, then use the comments section. And oh yes, please do subscribe to the channel so that you're kept updated with the latest on this channel. Thank you very much for your patient hearing. Bye for now.